All right, so today we're going to take a deep dive into how intelligent video solutions,
Okay.
or IVS, is using video technology to really shake up the world of clinical skills training.
Yeah.
We've got some of their materials,
Right.
and we're going to break down exactly what they're offering and what it could mean for, well, healthcare education.
Yeah, this is going to be interesting because for a long time, clinical training has really relied heavily on, that in-person observation
Right.
and feedback,
Mm.
which we know has limitations.
Mm-hmm.
So IVS is essentially proposing like this more tech-forward approach
Mm-hmm.
with a system that they call VALT.
Okay, so VALT,
Yeah.
what exactly is that?
So think of it as like a comprehensive platform, but it's designed specifically with clinical training in mind.
Mm.
It allows for video recording, observation, and review.
Mm-hmm.
And it's all within this secure and, according to IVS, user-friendly system.
Yep.
Where students can record their practice sessions.
Right.
They can get feedback from their instructors remotely.
Oh, wow.
And even access a library of what IVS calls best practice examples.
So instead of just relying on, notes or memories of a training session,
Exactly.
both the student and the educator have this video record that they can go back to.
Exactly. And that ability to review and analyze performance in detail, I think, is where the real potential lies.
Yeah.
Imagine being able to just break down a complex procedure or a counseling session.
Right.
Or even something as nuanced as bedside manner with a patient.
That makes a lot of sense, especially in fields where observation is key. I'm thinking about communicative disorders or psychology, where so much relies on those nonverbal cues.
Absolutely.
But I am curious, what does IVS say about the tech side of things?
Sure.
Is this something that would require a complete overhaul of a program's existing technology?
That's a good question. And actually, IVS has really, really focused on integration and ease of use.
Okay.
Their materials really emphasize that VALT is browser-based.
Okay.
So you don't need any clunky installations or specific hardware.
Okay.
And it's compatible across devices.
Wow.
They've even got this mobile app called Beam for recording in more dynamic settings.
Okay, hold on. Mobile recording in a clinical setting just immediately sends up some red flags for me regarding patient privacy.
Of course, yeah.
I mean, we're talking about incredibly sensitive information here.
You are absolutely right to flag that. And to their credit, IVS addresses these concerns head on.
Okay.
They really emphasize things like robust security controls, user authentication, and strict adherence to all of the relevant regulations. They really emphasize that this technology is designed with those considerations in mind, from the ground up.
Okay.
Yeah.
That's good to hear.
Yeah.
Okay, that's really good to hear. But I want to dig a little deeper into their claims about effectiveness here.
Sure.
Do they provide any evidence, actual evidence, that this technology actually leads to better training outcomes?
So they do highlight studies
Okay.
in their materials, but I think you're right to point out we should always be looking for that supporting evidence.
Right.
It's one thing to say video review leads to faster learning,
Right.
but how are we measuring that?
Exactly.
And IVS says that, having these video recordings allows students to identify areas for improvement that they might have otherwise missed.
Okay.
And instructors can give more targeted feedback.
That makes sense, intuitively.
Right.
But I'm always just curious, how do these claims
Yeah.
hold up in a real-world setting?
Right.
It's how do you measure something
Boy.
as subjective as bedside manner?
Yeah.
And even if you can measure improvement, how much of that is really directly because of the technology itself?
It's a great question. And it speaks to this need for rigorous evaluation, I think, in this field.
Right.
IVS does promote their library of best practice examples, which they say can really help students kind of visualize what good, even great clinical skills
Right.
can look like in practice.
Yeah.
But I'm curious to see, how are those examples chosen?
Right. Are they really best practices?
Right? Is there any evidence?
Or is it just someone's opinion?
Yeah, exactly. And even if they are objectively good examples, is watching enough?
Right.
Yeah,
because it seems like there's a risk of students just mimicking what they see
Totally.
without really understanding the underlying principles.
Absolutely. I agree. It's a delicate balance. And IVS seems aware of that, though.
Okay.
They really emphasize that this technology is meant to be a tool for self-reflection.
Right.
And personalized learning, not a way to just copy what others are doing.
Sure.
And having those recorded examples readily available could be very useful. you know, especially for visual learners.
Sure.
You know, it's like you can tell a student how to position their hands during like a physical exam.
Right.
But seeing a skilled practitioner do it on video could be way more effective.
For sure.
Right.
Yeah, I can definitely see that. But you mentioned this mobile app Beam earlier.
Yeah.
And the idea of recording in more dynamic settings. Can you elaborate on that a little bit?
Yeah. So IVS is essentially acknowledging that not all clinical training happens in a controlled classroom.
Right.
Or a simulated environment.
Sure.
Think about fields like social work, where students are going out into the community.
Right.
Or even just observing senior clinicians in a busy, like, hospital ward.
Of course.
These situations are much harder to capture with traditional observation methods.
Yeah, for sure. So Beam allows them to record those interactions.
Exactly.
With the proper consent, of course.
Of course, yeah.
And then review them later with their supervisors.
Exactly. And that's a really interesting application, I think, because it bridges that gap between the classroom and the real world.
Yeah.
Which could be a big hurdle for students.
Huge.
Right.
Yeah. And it allows supervisors to give feedback on skills that are really hard to simulate.
Yes.
Like adapting to unexpected situations or like managing a heavy caseload.
Exactly.
This is fascinating stuff, but I think it's also important to acknowledge that not everyone is comfortable being recorded, even for educational purposes.
Of course. Yeah, that's a really great point.
So how does IVS address that?
So they are very, very clear in their materials that patient consent is paramount. In fact, they've built in features to help institutions and students obtain and manage consent electronically.
Okay.
And they also recommend like transparency throughout the process.
Yeah.
You know, ensuring that patients understand exactly how these recordings will be used.
That's right.
And that they have the right to decline.
That's good to hear. But even if you address all of the ethical considerations and the practical concerns, there's still the human factor.
Totally.
That some people are just naturally camera shy.
Absolutely.
So how do you create a learning environment where students feel comfortable enough to like be themselves and take risks when they know that they're being recorded?
You've hit on like such a crucial point.
Yeah.
And I think it comes down to the skill of the educators.
Yeah.
It's about framing this technology as a tool for growth, not a judgment tool.
It's about creating a safe space for students to experiment, make mistakes, and learn from them.
Right. It's interesting you bring that up, like the role of educators, because it seems like even with all the best technology in the world, it still really comes down to that human element.
Absolutely. Technology can enhance the training process, you know, but it can't replace that guidance and mentorship that like experienced clinicians can offer.
For sure. So we've talked about the potential benefits, the ethical considerations, the importance of that human element.
Right.
But are there downsides to this technology? Are there any drawbacks that IVS acknowledges or that you see based on your own expertise?
Yeah, you know, it's a good question. And one concern that I always have with any new technology is that potential for over-reliance.
Right.
Like we want to make sure that students are still developing those critical thinking skills.
Right. Their ability to observe and respond to situations, you know, in real time, not just through the lens of a camera.
Totally. You don't want them to be so dependent on the technology that then they freeze up when it's not available.
Precisely. And there's also the potential for technology to like exacerbate existing inequalities.
Oh, that's interesting.
You know, for example, if certain programs have more access to this technology than others, it could create this divide in terms of like training quality and student preparedness.
That's a really good point, and it really highlights the need to make sure that everybody has access to these resources.
Absolutely.
It's not enough to just have the technology you have to make sure that it's being used in a way that actually benefits all students.
Exactly.
Helps create a more equitable healthcare system.
I couldn't agree more. And this all ties into like this bigger conversation about the role of technology in society as technology advances. We really need to be mindful of its impact on human interaction, on privacy, on equity.
Well said. So to wrap things up, where do you see this technology going in the future? What are some of the potential developments that IVS hints at or that you envision based on your own insights?
So one area where I think we'll see a lot of growth is in the use of artificial intelligence.
Okay.
You know, imagine a system that could actually analyze these recordings, not just for technical skill, but also for things like empathy, communication style, even potential biases.
That's getting a little sci-fi, isn't it?
It is a little bit, yeah.
But also incredibly fascinating.
Right, but it also raises some really important ethical questions about data privacy, algorithmic bias, the role of human judgment in healthcare. And these are all like really complex issues that we need to think about carefully as this technology keeps evolving.
Absolutely. It seems like this deep dive has maybe opened up more questions than answers, but in a good way.
Right.
It's definitely given us a lot to think about in terms of the future of clinical training and technology's role in all of this.
Yeah.
Well, this has been a fascinating conversation.
Thank you.
Thanks for joining me today.
It's been a pleasure. Thanks for having me.
And to all of you listening, thanks for joining us for this deep dive into the world of